Hi there, I'm Dr. Rao.
And I'm Dr. Afshar. We're both high-risk doctors in the Department of Obstetrics and Gynecology at UCLA Health. We're speaking today about COVID-19 and pregnancy, staying healthy, and what COVID-19 means for pregnant women and babies. So what is COVID-19? COVID-19 is a virus. Viral particles are tiny. They're thousands of times even smaller than bacteria. And the other thing is they're incredibly abundant. In one droplet, there's even 1 million little viruses, but luckily most of them don't harm humans. So what makes COVID-19 special, or what gives it its signature? There's a protein shell on the outside, and inside it is what gives it its signature. That RNA is specific to COVID-19. It's also known as SARS coronavirus 2. It's genetically very similar to what caused the SARS outbreak in 2002, and the difference was that RNA inside it. It's like a recipe. So to make a recipe to make this specific virus, you have to have these building blocks on the left. And then from there, you can have one of these Legos, the top one, the middle one, or the bottom one. And it's the bottom one that gives it a specific signature to COVID-19.
Dr. Afshar, can you tell us why this is so contagious?
Yeah, so the thing with viruses is that they need a host to reproduce. They don't reproduce on their own. They have to infect a cell, and then they just keep dividing and dividing and dividing, and they actually take over that cell completely. And that has to do with why it's so contagious. So this is a picture, just schematic infographic to show how viruses are infected and transmitted. So on the right, you have measles. You have the first infected patient on the right. So let's look at measles. And then many people turn green. So that's an R0, or the infectivity, or the reproductive number of a virus. Almost everyone there has a color. Now, when we look on the left, seasonal flu, its R0's about 1 to 2, and COVID-19 is right in the middle, about 2 to 3. So it's still very infective, and one person can infect many people. And so how that actually happens is that when we cough, we spread viruses by droplets. When we speak, we release droplets. And so prolonged unprotected contact between an infector and an infectee causes that, aerosol transmission causes that, and fomites. So fomites are any objects or materials that carry an infection. Research is changing fast, but we think it can survive on some surfaces up to 3 days. It lives on cardboard for 24 hours, on things like copper for 3 to 4 hours. So really it depends on the surface, and it's important to know that.
So how can we prevent transmission?
Yeah, so preventing transmission is really the tenet is social distancing, and we're going to spend a lot of time talking about that. So you can see the infected person in red has the potential to really cause spread. But if we social distance or we isolate ourselves in these little boxes, we can actually inhibit or decrease the level of transmission quite a bit. So who gets COVID-19? It generally infects us and it incubates in our body when we're living our lives, we're feeling well. It takes about 5 days. It's a range, 2 to 14 days, but about 5 days. It can shed for 20 days, even up to 37 days. It infects all sorts of ages, from 10 all the way up to 89. About 60 is pretty much the median, or in the middle there, but it really affects all ages. Little more predilection for men, but affects both men and women. But the one thing we know is that it actually, those that are a little sicker have a higher chance of getting COVID-19 and doing poorly from COVID-19.
So can you tell us what symptoms we need to be looking out for?
Yeah, so the big symptoms, this is from the Center for Disease Control, really the fever, the cough, the shortness of breath. These are the classic symptoms. There's other things. We get a little stomach upset, some diarrhea, we lose sense of taste and smell, we get body pains, but the classic ones are really fever, cough, and shortness of breath. And it's really important to know there are some emergency symptoms that we have. And this is if you are having trouble breathing, persistent chest pain, getting blue in the face and the lips. Did you see there? I didn't touch my face. We get confusion or inability to arouse a loved one. Those are emergencies. But the classic symptoms, really fever, cough, shortness of breath. And what happens is that virus goes inside into our bodies and affects other cells, affects completely normal cells, and it causes our body's fighting response, these cells, these inflammatory cells, cells that fight infections off, to get angry. They produce more cells, and it affects our lungs very, very significantly. And then when you go to the hospital and it's very severe, they'll notice you have abnormal lab testing. There'll be a chest x-ray or image of the lungs would be abnormal, or really just signs of bad respiratory distress. And again, these are the very severe cases. Luckily, the majority of the cases, or 80% of the cases, end up recovering completely. It's a long road, it's 2 to 3 weeks, but the majority do okay. Not all, but this is why the tenet of communication and being on the lookout for symptoms is incredibly important. So COVID-19 knows no borders, it has no boundaries, and it is affecting almost every country. There's about 380,000 cases right now worldwide. This is from 11 p.m. last night, and it's changed a little bit today and from when you watch this webinar. It affects every state. There are hot spots. That has a little bit to do with travel and just density of people, but it does affect every state. In the US, there's about 46,000 cases as of today, and in California, about 2,000 cases. So really, this is not about Dr. Rao or me, you, your loved one. It's about all of us. We are really all in this together. And how people are getting COVID-19, it's no longer just travel. We really thought it was related just to travel. But as you can see in the States, the majority has to do with close contact. And this goes back to social distancing. So that's COVID-19, just a quick little run through for all people. But Dr. Rao, can you speak to pregnancy specifically? What matters for our pregnant women?
Yeah, thank you, Dr. Afshar. That was great. So we're being asked a lot, what do we know about pregnancy? We are working very hard here at UCLA to figure out that exact question. What we do know so far is coming from published scientific reports and from data from prior coronaviruses and other viral illnesses. And what we know to date is that as of right now, those who have COVID-19 and who are pregnant do not have an increased risk of severe illness. And if you are pregnant, you do not have an increased risk of getting COVID-19 just because you are pregnant. I want to stress that this is a little bit different from some of the data that we've got from other viral illnesses. I know we've heard of people getting really sick from the flu when they're pregnant and from SARS and MERS. And what we're seeing is that this, as of right now, this virus is acting a little bit different. Again, I want to reiterate, this is from very early published reports, but the data we do have is very reassuring. So vertical transmission is a process by which when a woman gets infected, she might be able to pass that along to her child. As of right now, and as Dr. Afshar mentioned before, we don't believe that it is passed on through vertical transmission. We believe it's transmitted mostly by droplets. So as of right now, most of the infants that have been born to mothers who have COVID-19 have tested negative. In addition, when you look at amniotic fluid and cord blood and breast milk, what we see is that we don't find COVID-19 in those substances.
Well, that's pretty reassuring, but I think what's on most pregnant women's mind is how about their babies? How about their early babies? Is there a higher rate of miscarriages?
Those are also very good questions. So as of right now, with the limited case reports that we do have, what we are seeing is there are a little bit of an increased risk for preterm birth and babies being born a little bit smaller than average for women who have COVID-19. This is in line with some of the data that we've seen with other viral illnesses such as influenza, SARS, and MERS. But what we have in the data we have right now, it's not sure if these outcomes are because moms get the infection and pass it to the babies, or if it's just because moms get so sick and this is what happens afterwards. As it relates to COVID-19 and miscarriages, as of right now, we have very little data that COVID-19 can cause an increased risk of miscarriages. In general, there's mixed data about what happens when a woman is pregnant and she has a fever, and that happens with all viral illnesses. There are some data that say that there might be an increased risk of birth defects in general, but for right now, with specific to COVID-19, we do not have any data suggesting that that is true. In addition, when you look back at other viral epidemics like the SARS, what we saw during that time is specific to miscarriages and birth defects. There was not an increased risk during that time either.
You've said a lot of things. Can you reassure me a little bit about breastfeeding and the safety of hospitals?
Yeah. So I know a lot of women currently pregnant right now and thinking about, going to deliver very soon in the next 1 to 2 weeks are wondering all the same things. So one of the questions I get very frequently is it going to be okay for me to breastfeed if I get COVID? And as of right now, what we do know is that breastfeeding is a potentially important source of antibody protection for the babies. So it is not contraindicated to give breast milk to the baby. But we are in agreement with the Center for Disease Control, and we agree that if it is possible, we'd like to keep a distance between the mom and the baby to prevent transmission once the baby is born. But we do want the mom to express her breast milk, to pump in a breast pump, and to try and give that milk to the baby via a very well caregiver who can give the breast milk to the baby. If the mom says,
So,
did you have a question?
Yeah, breastfeeding is okay. Breastfeeding is safe. That's the end point?
Correct.
Okay.
A woman can breastfeed if she so chooses. Okay. If she were to choose to breastfeed, it would be very important to take all the precautions to prevent transmission to the baby. And what that would look like would be washing your hands, putting on gloves, and wearing a mask with each breastfeed.
Okay. That's reassuring.
And you asked another good question about, are hospitals safe right now? I'd like to reassure everyone watching this that we are doing everything we can to ensure the safety of patients who come into the hospital. Hospitals are working with very rigorous infection prevention protocols to ensure that everybody is safe. And in addition, they're making sure and planning ahead that all of the people who are working are staying safe, staying healthy in order to protect the patients who are coming. So at this time, it is very safe to come to a hospital.
I got asked recently if someone should do a home birth just to avoid the hospital.
So at this time, a home birth is not a suggested alternative to a hospital birth. We are in agreement with the American College of Obstetricians and Gynecologists and the American Academy of Pediatrics in agreeing that a planned hospital birth is safer than a planned home birth. So another question that I often get is, what's the visitor policy? I can tell you that that is changing. All hospitals are implementing stricter visitor policies, and that's just to ensure that everybody who walks through the door and everybody who's working stays safe. So what I would recommend is if you are going to be going to a hospital soon, please call your doctor or call the hospital to figure out what the visitor policy is. So we learned a lot about pregnancy, but can you tell me, Dr. Afshar, what can we do in general to just stay safe?
Yeah, so this has to do with what every single one of us can do. Pregnant, non-pregnant, loved ones, neighbors, someone you've never seen before. The tenet is avoid people who are sick and really wash your hands using soap and water for 20 seconds. If you don't have soap and water easily available, an alcohol hand sanitizer is an absolutely appropriate alternative. Avoid touching your face, and really, this has been hard for me. I've realized how much I touch my face for no reason. I'm sure all of us have been going through this. And the last two tenets are the same. Avoiding social gatherings and crowded places. That has to do with practicing social distancing. And you can see Dr. Rao and myself, we're a nice 6 feet apart from one another, and this is the closest we're gonna get. I love her, but this is the closest we're gonna get.
So what do I do if I'm sitting at home and I start to feel like, I don't feel so good, maybe I have a fever, maybe I have a cough? What do I do?
Yeah, so communicate. Your team at UCLA Health is here for you. We're here for you by phone 24/7, by MyChart, by email. We want to know what you're feeling. So if you're experiencing fever, cough, or shortness of breath, you're going to call us. We are available to you. We want to help triage these calls. And so we're going to do 3 different things. We're either going to talk to you and say, you should come in. You should come in yourself, or you should have someone drive you in. And that's going to be based on our conversation with one another. We may say, you know what? You are pretty sick, but you're absolutely safe to stay home. These are things you should look out for at home, but you can keep staying home and advise some home isolation. We'll be having you check your temperature once in a while. And then it may be an emergency. And this is, again, we talked about this briefly, but if you have trouble breathing, significant chest pain, or if someone is non-arousable, those are emergencies. That means call 911. There's no time even to call your doctor. So 3 different things. We're either going to tell you to come in, stay home, or it's going to be an absolute emergency. And so if we do have you come in, either to one of our clinics or to the hospital, we're going to be doing some testing. And testing at this point for COVID-19 is a swab. It's a nasopharyngeal swab, so it's a little small Q-tip through your nose. And we test it for the actual virus. At this point, there's no blood tests available, but that may be changing in a little bit. At this point, the CDC and UCLA here, we're all doing the same nasopharyngeal swab. And with that, things are changing. This is a pandemic. All the researchers, the scientists, the physicians, everyone's moving, and everyone is really coming together. Companies, as well as universities, we're working on vaccines. We are looking at medications that can both make the disease better, shorten the course of the disease, and then are really safe for both of our patients, because we have a pregnant mom as well as a baby. So these are all upcoming. We really are missing a lot of data, and this is why we're all moving the fastest we can.
So what should people do? Maybe they think they have it, or they're being tested for it, or they know they have it. Should they reach out to us? Can they help with gathering this information?
Yeah, we're all in this together. Research really requires every single woman who's being tested for COVID, even if she's negative, we hope, or that's COVID positive. We're trying to actually incorporate into a national registry. UCLA and UCSF just launched a huge national registry of pregnant women with COVID or being tested for COVID. We're trying to get data that is pregnancy specific, that can help us counsel our patients better, because we're really in a little bit of a black box. We're having these hard discussions without really good data. So you can help, and we'll put the link on the website if you want to enroll, or your physicians can enroll. It's really going to help other women significantly. So we made a list of a few questions that we get from women all the time. And so we'll kind of go through them. And one of the big ones I've been getting is, what if your doctor, what if your midwife is sick? What if she or he has COVID?
Yeah, that is a good question. So we are working very hard to keep all ourselves safe so that we can be available to take care of you guys. But there is a possibility that your obstetrician or your midwife could get COVID or is exposed, in which case they would not be available to deliver you. But please be reassured, UCLA is working and planning ahead so that there are going to be ample staff available, both obstetricians and midwives, who are available and safe and healthy to take care of you. Another question that I get often is, should we maybe hold off on trying to get pregnant? Is this not the right time? Should we be waiting for a different time? And if so, what would be that right time?
Yeah, so today and right now, to the best of our knowledge and to the best data we have, social distancing and being cooped up at home may just be the right time. But really, I joke, and the best time, we don't think there's any harm right now. So for those that are trying to conceive naturally, we think that it's safe at this point to continue to try. The only thing is, if you are undergoing IVF or in vitro fertilization, your reproductive endocrinology doctor is actually holding off on cycles. So we're not doing any cycles for IVF. However, for those that are naturally conceiving at this point, we actually think it's okay and safe. Oh, baby moons, baby showers. What do you think about that, Dr. Rao?
So we understand how important those things are and how people have been planning for that for a long time. But as of right now, we're going to be in line with social distancing and recommend that if these are large gatherings, or if this is travel to a far place that may include travel by plane, we're going to recommend that you hold off for now. We have talked about this before, but if you can get on FaceTime or Zoom and still have a celebration, we're all for it. We really do celebrate that this is a joyous occasion in your life, but just to keep everybody safe, we're going to recommend just holding off.
So is that the same for moms, sisters, cousins, BFFs traveling to be there to take care of our babies? Is that kind of the same?
Yeah, as of right now, what we're recommending is that people don't travel from location to location. Also, if we're considering that this is an elderly person, such as a mom, may not be the best time for them to be around different people in different locations. Again, we're going with social isolation, just kind of isolating yourself at home. We do understand how important social support is, but hopefully we can find somebody local.
Yeah, so with that, really, our number one goal is the safety of our patients. Safe mom, safe baby. And we practice this, and this is what we do every single day at UCLA Health. And I will say in Team LA, hashtag Team LA, hashtag Team World, really the world has become interconnected here. And this means that we're all practicing, hand washing, social distancing. We are in it together. So thank you so much, Dr. Rao, for chatting today. This was really fun, and I hope we've answered some of your questions. Please reach out to us by phone, by MyChart, in any way. Your UCLA physicians are here for you. Thank you.
And I'd just like to echo everything Dr. Afshar said. We thank you guys. We're working very hard for you guys to ensure that you are safe, and we are available for you. We are very excited to enjoy this joyous occasion with you coming up, and we ensure that we can make that as safe as possible. Thank you.